Nonprofit organization is providing a one-of-a-kind summer camp experience for children facing significant health challenges. North Star Reach is free for all campers to attend. It's located in Pinckney and provides a free year-round program, both remote and on campgrounds. Back in January, the camp got a matching grant of $600,000, and they expect to raise another $600,000 by the end of June. To tell us more about North Star Reach, we're joined by Sherry and JJ Lewis. Thank you both so much for being here. Okay, so I have to know all about North Star. The work you all are doing sounds incredible. So tell me how this came about.
So North Star Reach came about, first of all, we're a member camp of an organization called Serious Fun Children's Network of Camps, which was started, the first camp was built by Paul Newman in 1988, a hole-in-the-wall camp. We're the 9th camp in that network, and where there's 30 camp programs around the world where there's no camp land. So in 2011, our founder, Doug Armstrong, had a great idea to try and build this camp and convince University of Michigan to give us the land, and we leased the land for $1 a year for 50 years. I was the first board chair then and helped lead the team that raised $21 million to build camp. So we got camp built, and we got accreditation from Serious Fun, who has very high standards because our kids have medical challenges, and from the American Camp Association. We have a fully equipped medical facility on the property to accommodate all the kids' medical needs they need. So we built camp, and we opened camp in 2016, and for kids with cancer, kids on ventilators, kids with organ transplants, kids with sickle cell, kids that are dying, kids with all kinds of serious physical challenges. And then COVID happened, and we had to shut down because the kids weren't medically stable. So now we're back open. I'm board chair again. JJ is our CEO, and we've also included now kids with developmental challenges. So we have Friendship Circle comes and brings kids that have developmental challenges. We've had kids with autism, kids with hemophilia, but camp started in Michigan in 2011.
That's incredible, and the medical challenge component is key here, and now the other aspect of that. Why is it so important to have a camp for those kids in particular, JJ?
Well, growing up, I was a Boy Scout, and I was able to camp. And children with serious health challenges, there's a barrier to being able to access a camp and those experiences, and that's your medical needs. And what makes North Star Reach and Serious Fun Children's Camp so special is having a medical center right on site and having medical professionals who volunteer, doctors and nurses. And so there's no barriers now to accessing camp and this experience to have fun. As Paul Newman would say, raise a little hell, go fishing, archery, swim, you name it, the things of childhood, where again, some children wouldn't be able to experience, but thanks to North Star Reach, they can.
Yeah, and the kids go to camp for free, so the financial aspect of this is important as well. Right. You all raised some money or received some money, and you're trying to raise a certain dollar amount by the end of June. Right. Talk to me about that funding.
So we have some fabulous donors who have been with us since the beginning of when camp started in 2011, Gwen Haggerty-Bearden and Steve Bearden of the Von Voigtlander Foundation. And they've been very, very supportive for millions of dollars over the years, and have become very good friends and friends of North Star Reach, and wanted to be a part of our relaunch. We're calling this our relaunch. And so in January, offered us $600,000 in matching. It's in dollars, in grants, and in pledges. And so we said they'd like us to get it done soon. So we said, okay, how about like by the end of June? So far, we've raised about $300,000. So we're halfway there. And when we raise the rest of it, they will then put in their $600,000. So our operating costs are anywhere between $2 and $3 million. It depends how many sessions of camp we have. So we have week-long camps. So for instance, if you have had an organ transplant, say a heart transplant, a kidney transplant, liver transplant, eye transplant, you get to come to camp for transplant week. And then for sickle cell, they come, that's a different population that has different needs, so they come that week. We have family camps on the weekends so that the families get to understand what this child who has never been out of their sight, they're going to let them go to camp.
Yeah.
They need to see what it's like and be secure in the fact that their child is well taken care of. The medical needs are always taken care of, but they become sort of in the background. You know, the kids are like, oh, you want to see my heart transplant scar? And yeah, okay, let's go swimming or let's go on a zip line. You know,
They get to be a child.
They get to be a child.
Yeah, and that gets put on the back burner.
Right, and so Gwen and Steve have been very supportive. They feel very strongly about this. So we are, you know, nobody pays. You know, the kids all go for free. So our costs per year are anywhere from $2 to $3 million. So we're ramping up, and so we would love people to donate and come volunteer. You know, come be a volunteer camper, a counselor, be an arts and crafts person, come cook in our kitchens.
Well, the work you all are doing is phenomenal. We thank you so much for being here. And if people want to learn more, they can find information on our website. Thank you guys.
Thank you so much.
Thank you.